Earlier on in the day, I had some chest pains. About 10 years ago, I had a similar issue. I've got a family history of heart disease. If you are having a heart attack, it's basically consistent pain on the left-hand side. This is not medical advice, so go see a doctor if you have any heart issues. I'm doing all I can to be around for my kids. Could have a heart attack and die today, tomorrow, next year, who knows? All I can do is action the stuff that are within my control. Hey everyone, my name is Zopi. Welcome back to another episode where we talk about health, wealth and happiness. I've just come back from the ED, emergency department, and I thought I'll try and make a quick video before I forget all the details. So earlier on in the day, I had some chest pains. All I was doing was just walking with the kids. They were running ahead of me. I ran after them a little bit, but then my chest started hurting, so I sort of slowed down a bit. We just went to get a haircut, so it's not even far away from us. It's 300-400 meters from my house, which is convenient. But this sort of continued to come in and out, sort of stabbing sort of pains on the left side of my body. And I thought, I'll just wait it out. So I waited for about 4 more hours and thought, okay, better get it checked out. I'm fairly sure it's nothing. It's just a muscle pain. But the reason why I did end up getting it checked out was because I've got a family history of heart disease. So my dad had heart issues when he was in his 60s, got a couple of stents put in, and I think his father, my grandfather, even passed away from a heart attack, if I'm not mistaken. I better get that checked out. Actually asked Dad what happened with grandpa. Because of that family history and also because of my ethnicity, I thought I would get that checked out. The reason why I say the ethnicity part is about 10 years ago, I had a similar issue. And this was a brand new doctor I hadn't seen. It was while I was at work, I thought, geez, I'm having these sort of issues. Went to this clinic that I hadn't been before, and the doctor goes to me, are you Sri Lankan? I said, yes, I am. And turns out his wife is Sri Lankan, and he sort of knows that Sri Lankans tend to have a higher degree of heart attacks and heart problems, I guess, because of the diet and whatnot, the coconut milks that I used in the cooking. So anyway, he did an ECG back then, turned out to be nothing, but he goes, look, I'm glad you came in, we checked it out. Same issue today. And I had a feeling again, it was nothing, but I thought I'll get it checked out. So I went to this place, sort of near my house, about 10 minutes away, which is like a emergency, but not really an emergency. It is an emergency, but they're not a hospital. So went to the emergency. The guy was fairly nice. He was a nurse, I think. Went in within 5 minutes. I guess as soon as you say you got chest pains, they take you in. Did an ECG on the spot. I've still got the tags all over my body. And I didn't end up seeing the doctor. He ended up talking to the doctor on my behalf, but the doctor told him, hey, even though it's a low risk, it's all good, the ECG is clear, but go to the emergency department anyway to get some bloods done. And what do they call the bloods? The troponins or something? So I had to get them done because this particular clinic couldn't do them on the spot. So ended up going to the emergency department. As soon as I got there, the triage nurse was annoyed that they had sent me instead of getting it done, but I don't think she knew that the other place couldn't do the bloods on the spot. Anyway, asked a bunch of questions at the triage desk. Again, I got in within a couple of minutes, because as soon as you say it's heart issues, I guess they take it seriously. Did an ECG again, that was clear, and did the bloods as well, and that was also clear. So all in all, clear. And the doctor, shout out to Dr. Om, who was there, and Wendy, the nurse as well, who were both lovely people. Like, they really love their jobs. At least they come across that way. So their bedside manner was really good. So appreciate that. But the doctor was saying that in terms of, I'm only telling you this just so you can sort of figure this out if you have any issues like this in the future. So if you are having a heart attack, it's basically consistent pain on the left-hand side where, we've got someone sitting on you. They say close to like an elephant sitting on your chest on the left-hand side, and the pain generally increases. whereas my pain was intermittent, can't even say the word, but you know what I mean, jabbing pains that were like sharp jabbing pains that would come and go, come and go, come and go. So obviously they ruled out it's most likely not the heart, or they said it's very close to 0%. It's nothing to do with the heart, and the ECG came out clear as well. And again, the blood tests came out clear after 6 hours. Apparently, they can sort of determine, or 4 hours. This is not medical advice, so go see a doctor if you have any heart issues. That's the bottom line of this video. But all in all, came out clear. I did speak to my dad earlier in the day, and when I told him, he goes, "Did you lift anything heavy?" And I'm going, "Oh, I did. I lifted a heavy suitcase yesterday." And you don't think about it because you just do it. And I'm left-handed, so my hand would go there and I would lift it up. And so I must have pulled something here. So all in all, no biggie. All I'm doing is from my end, this is the irony of this whole thing. I'm doing everything that I can from my end to lead a good, healthy lifestyle. I'm eating right. I'm exercising where I can. I don't smoke. I don't drink. I, sleep as much as I can. I do have a bunch of stress around me, but I do manage that the best I can. So, from a personal level, an individual, I'm doing all I can to be around for my kids when they're older, or until they get older. That's my mission, goal. I'm not doing it really for me. I'm doing it making sure that I'm here just so I can help them through life and whatnot. But irrespective of what I do as an individual, I may have another fate. So I could have a heart attack and die today, tomorrow, next year, who knows? It's beyond my control. I can't dwell about that. I can't cry about that. All I can do is action the stuff that are within my control. That's all I can do. I'm one person. If I can do something to help my own situation, why not? Therefore, I'll drink that extra glass of water every day. I'll go for that walk after work, even though I'm tired. I'll make sure I have my smoothie full of my special ingredients in the morning. Special ingredients meaning flax seeds, wheat germ, walnuts, and all that stuff. Nothing crash hot. So that's it. I hope you got something out of this video, but if you've got any advice for me, always let me know. I'm always happy to learn from others. All the best. See you in the next one. Thank you so much. Bye.